News Radio 700 WLW.
Back with Eddie and Rocky, and a lot of us are feeling good about the holidays. We're week out more or less from Christmas, and it's fun. You're with your little kids, and that's great. You got the little children. I mean, I remember when my kids were young, and my guys are going to come home from college and spend some time with us. And it's great to have your family around you. But you know what? There are people, obviously, who don't have that option.
Right. There's that, but there's also people that have family, but because of COVID, can't see them, can't get together. I mean, I don't know if we'll see my folks and my wife's folks on Christmas because everyone's being, cautious, especially in their age bracket and all that. So even that can pile on more of just the negativity and depression around the holidays.
Well, let's talk about depression around this time of year, because even in normal times, depression is an issue around Christmas. Well, let's talk to our friend, Dr. Mark Schillinger. Doctor, welcome to the program.
Thanks for having me. Happy to be here today.
So Mark, what advice do you give to someone who's depressed this time of year? And I think it's very common that people, like Rock and I were saying, it's understandable if you're alone or you've lost a loved one or whatever the case might be. That's understandable. But when everybody else is joyous around you and having a good time and trying to make the best of a bad situation, but you're still depressed, what advice, what kind of a treatment can those people go through?
Yeah. Well, as a doctor who specializes in stress management, I've had lots of years working with this, and because I also run a family nonprofit that specializes in working with young men, I have a good sense as to what's happening in families, and especially now during the holidays, there is a lot of stress. Certainly for everybody in a family that I work with, whether they're depressed or not, I teach them all, if they're going to really get along during the holidays, I teach them all a very simple, mindfulness-based stress reduction technique that takes about 15 or 20 seconds to relax. So when you ask me, what does a depressed person do? All the time when I'm working with my patients who are anxious or depressed, I'm always encouraging them to return to just staying in the present moment by learning a way to control their breath and keep their mind focused on the present, because this will then change their brain chemistry from going into the adrenaline and cortisol of worrying and being anxious versus the endorphins and the dopamine and the serotonin that actually relax and calm the body. It's hard for someone to be depressed in a family where everybody else is not, especially if the family is not sensitive to how to be with that person, which is to really encourage them to stay calm as possible.
I think what you're saying is one person maybe that's either depressed or getting ready to kind of go off go off on people, that can work. But when there's multiple people, that just kind of adds gas to the situation. Is that kind of what you're saying?
Oh, absolutely, absolutely. Because most people, they want to be joyful for the holidays. This is, especially with the pandemic and all the different climate changes and just the usual holiday stress. It's hard for people to want to sort of change their energy from celebration and being joyful to taking care of somebody who may be anxious or depressed. So one of the things that I recommend in my work with families is that everybody should have a way to communicate in a respectful way that promotes every person to really say what's true for them. So if there is somebody who's anxious or depressed and they're at a family party, they should feel safe enough with everybody else to communicate what's happening to them, and then everybody else should make it safe for them, safe for that person to be in the house and to celebrate. And if they really can't, then they should be encouraged to just pick one or two people to talk to at a time and not try to be in the room with everybody, because it can be overwhelming. But the main thing is for those people who are happy to be respectful and to be calm and to not make fun of that person. That only makes everything worse.
So we're talking to Dr. Mark Schillinger. So, Doctor, as far as you're alone, you can't be with your family, you don't want to travel, they don't want you to travel. How do you combat that?
Well, definitely being on the phone or being on Zoom with as many friends or family members. One of the things that I know many people will be doing this holiday, I certainly will be, my family's spread out all around the country, so we'll have family Zoom time. So for the person who is isolated, the more they can either get on Zoom or on a phone call with people they know and love, the better. And also what I'm recommending is, because we all need to be outdoors as much as we can, I recommend that person who may be suffering from depression, anxiety, and being isolated to get outside. And if you do have friends, to even meet with them. And that can be done socially distanced and with a mask, but to connect any way possible. I have noticed in my practice more and more patients who tend to live alone are buying pets and getting involved with pets, and something they can touch and cuddle and love and get affection from.
Dr. Mark Schillinger, we really appreciate you talking to us. Thanks so much.
Thanks for having me. I really appreciate it.
Thanks, Doc.
Great advice.